Hey guys, Hank here again. Today we're going to discuss PD5 inhibitors like Viagra or Cialis, for example, and everybody knows that they've been a game changer as far as men's sexual health and well-being and like erectile function, but there's also a very hidden but very crucial role in PE that I'm going to explore today. And in my opinion, these are like game-changing benefits. And so I'm going to go over what I recommend and overall the science behind it today. So let's explore. So to start, what are we talking about here? What is a PD5 inhibitor? And so it's a type 5 phosphodiesterase enzyme inhibitor, okay? What the fuck does that mean? Well, if you look here on this chart, and so I covered this before in my nitric oxide pathway, but this is basically how erections occur. And so either through the endothelial cells or the cavernous nerves, you get nitric oxide release. That nitric oxide is then the stimulus to convert guanylate cyclase to cGMP. cGMP then activates the protein-specific kinase, and that allows basically potassium and calcium channel to activate in such a way that you get smooth muscle relaxation, okay? The thing that PDE5 does is it converts the cGMP away from the active form to something that's just called 5-GMP. Okay, so what it does is it takes you from being in a state of erection and smooth muscle relaxation, allowing the chambers to fill with blood. It causes that to shut down and decreases that blood flow and causes you to literally lose an erection. So when you have that PDE5 inhibition, you just have increased levels of the cGMP, which allow increased stimulation for your smooth muscles to relax, which keep you in that erect state for longer and allow better and more pronounced erections, okay? They don't work for everybody. So why is that? Well, like I covered before, 30 to 40% of men don't have appropriate nitric oxide in their blood or in their system to activate erectile function pathway, okay? Once again, when you're looking at the endothelial nerve or the cavernous nerve releasing NO, that is the actual catalyst to start this process. So if you do not have nitric oxide in your body, you will not be able to get a good erection. Fun fact, a lot of over-the-counter mouthwashes actually kill the bacteria in your mouth that actually produce nitric oxide. So if you are not on a nitric oxide booster, some actual NO inhibition can occur when you're using a mouthwash. So just be aware of that. It's also important that if you want maximal erection quality, then get a good citrulline-based supplement like, one we have Vigor over at Leviathan and some. So guys, why do I recommend you be on a PDE5 inhibitor like Viagra or Cialis if you're going to be doing PE? Well, there is a lot of injury that can occur on both a macroscopic level, meaning what you can see, changes you can see like stretch marks or decoloration, but you can also see it on a microscopic level. What I get concerned about is what I'm doing trauma-wise to my penis. What effect is that going to have in 10, 20, 30 years, okay? I want to have a very high-functioning penis, even when I'm into my 60s, 70s, 80s, whatever it may be. And so I'm going to elaborate what this medicine can do. A lot of where this comes from is something that's called penile rehab. So when you have an injury like prostate surgery or even like a pelvic crush injury, there is this new form of regenerative medicine. It's called penile therapy, where they start patients on high levels of PDE5 inhibitors like Viagra because it has been shown to maximize erectile function and maximize penile function long term, especially when you're dealing with damage to things like the neurovascular structures in the area. And so as you can see in these little pathways here, that you have basically neural image that occurs with surgery, then you have damage to that nerve, and then as a result, you have loss of smooth muscle and fibrosis and basically cavernous veno-occlusive disease, where basically you just don't have a functioning penis anymore. And so what you can see is that if you supplement with something like a PDE5 inhibitor, you have increased that cGMP, which leads to increased smooth muscle relaxation, and you have preservation of the smooth muscle, which is, in my opinion, the number one most important thing as far as overall penile function and penile health. And then you have reduced collagen synthesis. I don't know if people even know this, but when you undergo fibrosis, whether it be like pulmonary fibrosis in the lung, you have functioning tissue that gets converted into collagen, okay? And I know, yes, collagen is a part of the penis. I don't know how I feel about collagen supplementation when it comes to PE, just so you know. That's something that I'll have to explore deeper. I asked a urologist about the effects of collagen on, fibrosis, and he said it probably doesn't matter, but he wouldn't recommend high amounts, just, as an aside, okay? Studies have shown that if you start taking Viagra, for example, 100 milligrams twice a week for 3 months, you can lead to recovery and preservation of your erectile function, okay? And so what are the pathways with which this works? So number one, increasing intercavernosal oxygenation. So inside the caverns of your penis, you have increased fresh oxygenated blood because you have more smooth muscle dilation, allowing that blood to come in, okay? So even in the absence of an erection, you actually have increased oxygenation at a baseline. So you do not need to induce an erection to still get these benefits. That's a very key point right there, okay? You can also have, once again, increased concentrations of the cGMP, which leads to smooth muscle preservation. And so this was actually demonstrated in a study when they actually did biopsies of the penis, stuck a needle in there, got tissues, and evaluated the smooth muscle concentrations. And you can see that especially at higher doses of Viagra, at 6 months, you had higher levels of functioning smooth muscle cells. Very important. Along with that, we already talked about, you can have the reduction of collagen synthesis, which is effectively the process of literal fibrosis, converting functional tissue to non-functional collagen. And that's demonstrated in this little excerpt here. And this was studied in rats that actually had basically damage to their penile structures, and it actually measured things like nitric oxide synthase levels as well as collagen levels, smooth muscle, smooth muscle, etc. Okay, and you also see what we call as decreased apoptosis. Apoptosis, for those that don't know, is programmed cell death. Okay, when you have an injury that occurs and you have non-functioning tissue, your body's going to be like, dude, this tissue's non-functioning, we don't need it. Apoptosis. Okay, let's just start getting rid of this tissue. Where I think this comes into play is I think the amount of potential damage that occurs to our penises on a daily basis with PE, I think it's greatly underestimated. I'm not trying to be a fucking alarmist or whatever the haters or critics of me want to say. This is just objective information that is based on science and my interpretation of it, okay? So do with this what you will, all right? I'm just trying to promote this information, okay? So take this study. They actually, once again, it was done on rats where they actually looked at traction on the penis of the rat. And what you can see is that when you have continuous traction on the dorsal nerve of the penis in rats, you actually start to develop apoptosis within 2 minutes of having the traction in place, okay? It doesn't take that much damage. Now that is specifically taking the nerve, stretching it, and then seeing what leads to apoptosis. But similarly, when we are stretching our dicks, especially these guys using like extenders or hangers longer than they should, and it's for hours on end, that is putting a lot of fucking stress on your nerve, man. And so that can induce literal apoptosis, programmed cell death of that area. Okay. And then once again, you can see that, especially when you have an injury. And so apoptosis can occur as early as 1 day after a nerve ablation. So you're fucking around, jelking, I don't know, cause a nerve injury and your dick goes limp. Within 1 day, you can start to have apoptosis or cell death develop in the penis. On what meaningful level is it? It's hard to say, but you can start to see those changes pretty much immediately. And that's why I think it's important to be proactive with this stuff. Okay. If you've seen my video on megalophallus, okay, I talked about a lot of the potential injuries that can occur from ischemic changes that occur to the penis when you're doing things that cause occlusion, like clamping, for example, okay? That can be very damaging and very, very disruptive to the penile tissue depending on how you do it. And even things like pumping, if you actually look at the guides, I think they're basing this off megalophallus data, but they say don't pump for too long or at too high pressures because it can cause you to lose erectile function long term. How do you guys think this shit is happening? It's from damage primarily to the smooth muscle. Also, you can damage the neurovascular bundle as well, for sure, but you get replacement of that functional tissue with collagen and induce fibrosis. And that's what these medications are trying to prevent, okay? Stretching, twisting, pumping, clamping, all of this shit is causing trauma to your dick. Like, I don't understand why it's so controversial for me to say to some people, I recommend these medications to prevent you from putting yourself at risk down the line. It's like, you fucking kids these days, stay off my lawn. But you guys are doing steroids and all this shit. And I'm like, guys, are you even aware of how this might impact you later on? And that's what this is trying to prevent. You want a bigger dick. We honestly do not have data outside of a few anecdotal stories of, vets that have said, oh, well, I've been doing this for 10 years and I still have erectile function. Let's get ahead of this, guys. And what I'm talking about is low doses to prevent this from happening. But what's also important is that even things like normal aging, okay, and of course things like hypertension, diabetes, they can all lead to damage to the penile tissue and endothelium, okay? There's something that's called like reactive oxygen species, but basically what happens is you create these free radicals in your body and it can damage the endothelium of your cells, okay? So as you can see in this study here, in this rat study, these rats actually had diabetes and it showed that you had improved endothelial and smooth muscle muscle staining when you have chronic vardenafil use, okay? It's just another PDE5 inhibitor. And so there's clear evidence of this. And what you also see is that the aging process is associated with fewer smooth muscle cells and increased fibrosis within the corpus cavernosa, preventing adequate penile engorgement and pressure on the penile veins. PDE5 inhibitors can prevent these changes. This is from an actual published abstract that you can see. So even the guys that aren't doing PE, on some level, there's a threshold. It's not just like anybody 18 or older start this shit, but there's benefit from even normal aging. So, why would you not do it? Whatever. That's something that we can talk about. I think the most important application of this is with actual injury recovery, okay? Honestly, it's getting overwhelming how many people are reaching out to me on my Patreon and ask for injury coaching. But I think that the injury recovery is the most applicable of all of this stuff. So if you want to ignore any of the shit I said, if you get injured from PE, you need to think about this, okay? Especially with nerve injuries. There's a study that showed that if you have a nerve injury, you can have dramatic improvements in recovery of spontaneous erections if you start PDE5 inhibitors early. So if you get injured, it makes sense, pending doctor's recommendations, to start this shit, okay? You want to maximize that blood flow in. It pisses me off when these guys get injured and I'm like, you need to start PDE5 inhibitors, and they're like, oh, I don't want a Band-Aid, I want to fix my erection. This isn't a Band-Aid. What this is actually causing your penile tissue to recover so you can have improved erections long term. And there's also studies that have shown that when you start these PDE5 inhibitors as soon as you can, especially within the first month after an injury, you can have the best chance at recovery of meaningful erectile function, okay? What are some misconceptions that are associated with this? Well, number one, you do not get physically addicted or dependent to it, or you do not build up a tolerance, okay? Those do not happen. That's been proven time and time again. What you can have is something that's called a psychological addiction, okay? This is akin to somebody who were to go on a cycle of steroids. Previously, they could only lift 100 pounds, and then they go on a cycle of steroids and they're lifting 200 pounds and they're feeling like the man. Then they come off the steroids, okay? They're gonna be back down to lifting, 100 pounds, maybe more. We're not gonna get into that, guys. Just bear with the fucking example, okay? The same thing can happen when you have an erection, is that if you are, you have what you think is 100% erection, then you start taking Viagra and all of a sudden you're like, holy shit, so this is what a real erection is like. And you have these rock hard diamond erections, and then you decide to stop taking that Viagra. You might even think that something is wrong with your dick because it's not functioning to the level that it was before. And so that can develop a psychological addiction. And I certainly try to cycle off myself. I am on low doses of these medicines, but when it comes time and I know that, hey, it's game time and that my girl is down for it, I always want to be taking Viagra because I always want to be at my best. And whereas if I had never taken it, I would never known what that next level is like. But you don't get addicted to it or anything like that, okay? There's no physical addiction, just psychological addiction, which is not to be understated. So what are the effects? So short-term effects are mostly things like headache or flushing. Things that are going to result from increased blood flow, okay? When we're looking at long-term effects, so there's no tremendous long studies, not yet, okay? But most of the studies show that long-term side effects at about 4 years are about 3.8%. And most of this were things like headaches, indigestion, maybe some runny nose or some flushing, okay? So really minor shit. On this major study, there was no major issues like cardiac events or cancer or any shit like that, okay? So there's no long-term side effects, long-term honestly being about 4 or 5 years at this point, okay? Another effect that is pretty interesting is actually vision changes can occur. Sometimes these people can report seeing a blue light. The reason for that is actually twofold, okay? PDE inhibitors, although they are pretty specific, sometimes they are not as specific as they could be. So in certain people, inside your actual blood retina barrier, there's something called PDE6, phosphodiesterase 6, okay? It is similar to PDE5, and sometimes when you take these substances, there can be some effect on the PDE6, and when that happens, it can actually lead to blue light or even blurred vision when you're on this medication. Usually this is mild and transient, and it's not like a big deal, but it's something that can be very concerning, and that some people do report seeing a blue light. Now, on the contrary, there's a very rare but serious side effect, and it's called non-arteritic anterior ischemic optic neuropathy. I'm going to discuss that in just a second because it comes into the kind of cardiac cardiac issues. But one thing I want to discuss is that there's no effect on semen or sperm count with this. So if you're worried about fertility, you want to have a baby, you can be on Viagra or Viagra-like medications without any impact on your actual semen. Another thing to keep in mind is when they look at these studies of side effects, these weren't in otherwise healthy guys, okay? Like I feel like most of the population doing PE is usually somewhere between like 18 to 40-ish, maybe 50-ish. Every now and then you see an outlier, and more power to you, my friend. So when you're talking about people that need to go on Viagra, it's people that have shit like chronic hypertension, chronic diabetes, vascular injuries that need to be on this medication. So when you're looking at the side effect profile on these studies, you have to understand the actual patient population that they looked at. It's not healthy guys. So that's the long way of saying to your average healthy guy, talk to your doctor about it, but your chance of you having major side effects is extremely low, okay? So what are like the rare but very serious side effects? They basically come from taking either too much or having a problem with your body where your blood pressure drops too quickly and it causes problems elsewhere. And so as I mentioned, you have that non-arteritic anterior ischemic optic neuropathy, or NANION, and it's basically this painless condition where you take a bunch of Viagra and your body dilates blood to other places, and so you actually have like ischemic or lack of oxygenation to your blood because your blood vessels have dilated so much that you are not adequately perfusing your eyes, and as a result you can have an immediate drop and you get oxygenation problems, and it can actually lead to permanent vision changes. Extremely rare. There's actually an article in Nature that talks about it. If you want to Google it, there's a screenshot up here, okay? Heart attacks. Basically what can happen is something similar. You have that coronary steal syndrome. If you are already on a nitrate or you're already on something else that's going to already have your blood pressure at a very low level, then you take a bunch of Viagra and you have a reaction to it, and your body dilates and the blood is going elsewhere outside of perfusing your heart or getting the blood to your heart, you can have an ischemic heart attack that occurs because you're not adequately perfusing your heart, because your blood pressure drops so low, okay? Now, this is one thing that 85% of guys are not aware of, according to this study, but you have to be careful when you take this medication with alcohol. A lot of guys go out and they get fucking drunk and want to have sex with whoever, and then they take Viagra. Alcohol basically has a vasodilatory effect as well, okay? Meaning your blood vessels are normally like this, it causes them to dilate, okay? That in itself can actually drop your blood pressure. So if you are abusing alcohol or have high levels in it, and then you take high levels of a PDE5 inhibitor and that further gets dilated, there are studies showing that you can have significant chest pain and even EKG changes because of those effects from that coronary steal syndrome, taking the blood away from your heart. You guys really need to be careful if you are abusing alcohol. And on this study, it was greater than, I think, 13 drinks a week. And so just be careful. It's in high doses, but still, it's worth being cautious, okay? So what do you need to do before starting? Talk to your fucking doctor. Like, once again, I'm going on a rant here, but it blows my fucking mind how many guys are completely like just ill-informed and willing, oh, well, I read something on, some guy was like, oh yeah, I read something on fucking Twitter about taking aspirin and so I'm doing it. And I'm just like, guys, are you fucking kidding me? Like, come on. Anyways, don't go through some shitty like third, party website in some foreign country or something. Get it from a doctor, have a conversation with the doctor when you can, and do this shit safely and do it smartly if you're going to do it, okay? So please talk to a doctor. How do you get it? Well, there's resources like Blue Chew or Hims, or even something called GoodRx Gold, where you can actually have a telemedicine appointment. How I first got my prescription was I went on Hims, and I'm older, I'm 40, and I said, I have erectile dysfunction. I want erectile function medication. And they said, okay, great. Here's your prescription for erectile function medication. Okay, it was literally that simple. It was maybe a 45-second phone call and me clicking a few boxes online, okay? If you do get that official prescription, which I recommend, and you're in the US or another state or another country that honors GoodRx, check out GoodRx. It's a website. I'll put up some screenshots here. But I got I must have got 95 milligram pills of Cialis, and it was literally $17, okay? And I didn't have my insurance card or anything like that. It was just through the coupon using GoodRx. And so it'll actually show you where are the cheapest places to get this medication. And so I strongly recommend you do that. You can save your money. And once again, they have GoodRx Gold, where you can actually have a telemedicine appointment to get a prescription on the fly, okay? The last resource is there's something that's called All Day Chemist, okay? There's a box where you are supposed to check check, like, I have had this prescription approved from my doctor, but you technically don't need a prescription to go this route. I would not recommend this. Number one, there's no quality guarantee of the product that you're getting, which is one issue that I have with this. But also, you guys, there's doctors, there's health professionals for a reason. You can't just, fucking just, oh, I read something on Twitter and that's why I'm going to do it. So I wouldn't recommend this, but especially in the sense that you can't get the prescription elsewise and you feel like it's vitally important, that is an option, okay? So in conclusion, I think that one of the most vital components in anybody's PE routine should be incorporation of a PDE5 inhibitor like Viagra or Cialis, generics, whatever, it doesn't fucking matter, okay? Especially if you have certain types of injury recovery. There's even evidence that PDE5 inhibitors can help with pelvic floor dysfunction, okay, by the actual relaxation and vasodilatory mechanism that they induce. So if you do have an injury, I strongly recommend you consider that, okay? In certain injuries, don't do it willy-nilly if you can. I can't stress this enough. If you don't want to take the medicine, then just don't fucking take it. Like, I don't understand why these guys, they have their thoughts and feelings about medications in the fucking comment section and just go off and, can be just plain disrespectful and shit. And so if you don't want to take it, don't fucking take it. I'm trying to promote this information, okay? Taking a lot of time out of my fucking clinic to do this as well. If you want to take it, take it. I've listed the reasons why it might be appropriate for you. Talk to your doctor. If you don't want to take it, then don't take it. Just fucking chill sometimes, guys. Anyways, part 2 is coming soon, and that's going to be like my specific recommendations. How do I take it? When do I take it? What personally do I recommend? All this information is also available on my Reddit post, okay? If you want more of like a typed format. Speaking of like injury consultation, I do injury coaching via my Patreon. So if you have an injury and you're thinking about getting Viagra or whatever, I cannot prescribe that shit to you because I'm not giving up my anonymity to send in a prescription for you. But I can injury coach you there, okay? I don't really do PE coaching just because I don't really know that much about it, to be quite honest. I know it's worked for me and what I've researched, but go to somebody else for that if you want that.